Respected colleagues, we gynecologists are trusted more than any other specialist. Whenever a woman comes to us for gynecological problems, we must see her body language for unspoken pains, fears, and tears. Many of their problems do not show up on ultrasound and blood test. They live quietly in their mind and heart. And the eyes and the body language speaks. Mental health is the most ignored dimension of women health, especially in India. We are not trained well in the four walls of medical college if you don't specialize in psychiatry. We treat anemia, we treat hypertension, we treat gestational diabetes, we treat infertility, we treat abnormal uterine bleeding. But how many times do we ask her, how are you? Hope you're coping up emotionally well? And at this time, watch your body language. This question is a game changer, which can save a woman's life. The various common mental issues, there's a wide spectrum. We see cases of anxiety. As a gynecologist, there's a fear of infertility, fear of miscarriage, fear of cancer. Depression is often masked as a body pain, fatigue, irregular cycles. And many times you see the somatic distress presents as chronic pelvic pain. There's no organic cause. You've screened her well. There are sleep disturbances, irritability, emotional withdrawals. Slightly elderly, you find there is a fear of menopause, fear of aging, loss of beauty after childbirth. So our clinic should become a very safe place when she can open up, where she's seen without any judgment. They can trust us not just for their gynecological problem, but their hidden wounds, trauma. During pregnancy, you find that it's a very natural process, very powerful part of their life, but it's a vulnerable phase. I call it the time of biological and emotional storms. 1 in every 4 pregnant women suffers from anxiety or depression. And in most cases, it goes recognized because we are not trained. The common triggers are fear of miscarriage, fear of abnormality, fetal abnormality during pregnancy. And then delivery pain also scares her. Domestic tensions, lack of partner support also manifest. Then in case if it's a working woman, then there's a job insecurity and financial stress in case if she leaves the job. Body image worries her, but you have to reassure her. And for an Indian woman, there's always a pressure to produce a male child. All said and done, is a fact that quite a good number, 15 to 20%, develop tocophobia, fear of childbirth. And then in case if there is an abortion or there is a perinatal loss, then she has sleepless nights, silent tears are flowing all the time. There's a feeling of guilt. And we should not forget postpartum period, when she slides into depression and psychosis. Because, she's fine that, she's breastfeeding or taking care of the child all the time. And if she, reflects, she feels scared about her future. And the relatives and the close family members pass it as a normal new mother stress. Now, I admit that in India, the mental health care is suboptimal. All mental health issues are because of social pressures or because of the, relationships are not congenial. She has grown up in gender bias, emotional abuse, and partly isolation. Infertility, in case if she has it, it brings a stigma. If she has not produced a male child, again, it's a stigma. And then you find if there's over involvement of in-laws and neglect her partners, then you can imagine her stress. For a woman who's a homemaker, 24/7, calm, 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 there's no time for herself. We must remember that no uterus can stay healthy in unhappy mind. If she has an unhappy mind, it will present as abnormal bleeding, various somatic pains, and the underlying factor is that she is not emotionally okay. We gynecologists are the first doctors where the woman has trust. When she says, "Doctor, मुझे थकान सी रहती हर समय," आपके कान खड़े हो जाने चाहिए. Ask her, are you sleeping properly? Are you feeling low? Tell me something about yourself. And these days you can find very simple tools like Patient Healthcare Questionnaire 9, where there are 9 simple questions. And you can come to know the flag signs that, no, this patient requires care. This patient requires my time. This patient requires referral. I cannot ignore her. So we feel that, mental health, on this day, we must pledge that we will give her time, that she is emotionally okay.